Hi guys, welcome back to Your Face Unfiltered. I'm Dr. Keith Ladner, double board certified facial plastic surgeon. And today I have the pleasure of having our own COO, Kelly Herbert, on our show to interview me and ask me some tough questions. So welcome, Kelly.
Thank you. And I'm really excited to be here. I'm going to jump right in and start with some questions, if that's okay.
Let's do it.
So we're talking today about facelifts through the decades. And I really want to know, where did facelifts begin? When did they actually start? What's the first facelift that you've heard about? Is it in the 60s or 70s? Tell us a little bit about that.
Yeah, so if you look back at the historical records, it's pretty well accepted that the first facelifts really actually started at the turn of the 20th century. So
Oh, wow.
as early as the first decade in the 1900s. Facelifts obviously didn't increase in popularity, however, until much later with the skin-only facelifts in the 50s and the 60s. But there were surgeons that were describing facelifts, and especially in that second decade of the 1900s. I believe 1916 was when it really sort of became a known thing in textbooks.
Got it. And so we're going to talk a lot about the different kinds of facelifts. I want to talk about the wind tunnel era. I've seen pictures of old celebrities from like 80s and 90s. They were really tight. They had this appearance that kind of looked like the Joker. Everybody looked really stretched back. What was that?
Yeah, so a lot of things can lead to that appearance. And I'd say that probably the most important thing is over-reliance on the skin envelope itself. And so not addressing the deeper structures. So that would be number one. So the skin looks too taut, it looks too pulled because it really is taking all of that tension. It's not that belt and suspenders of the procedure, or shouldn't be the belt and suspenders of the procedure that now the SMAS and the deep plane technique obviously has replaced. That'd be number one. Number two, I think what drove a lot of that was the short incision facelift. And so because of celebrities saying, hey, I need to get back out into the public spotlight, I need to start filming again for that movie that's coming out this summer, surgeons would then say, okay, well, let's do this. Let's make most of your incisions behind your ear, and we can pull your face back behind your ear, and they'll never see those incisions. But what we obviously now understand, and probably did at the time, is that gravity pulls us down. And so those incisions have to be carefully planned to make sure that we truly are resuspending patients back to where they started in a natural vector, as I like to call it. So I think that the vector, the repositioning was also off with that wind slip look. And then I think the other thing too is devolumization. And so folks that were either devolumized with surgery or just naturally lost a lot of volume in their face, and then they kept getting facelift after facelift, they started looking weird, right? Because as I remind my patients, and this is the reason why we do so much fat grafting at the time of a facelift, is because facelifts don't volumize. They don't restore volume back to the patient. They reposition some of that volume. They restore that natural position of the SMAS and the skin and some of those underlying fat pads that go along with it. But we're not actually adding volume back. And so fat grafting wasn't a thing back then, right? And so if they had 2-3 facelifts, they actually started losing volume and they started looking a little bit weird and strange as well. So all those three things and probably some other things play into it.
That makes sense. Okay, so let's talk about the skin-only approach.
Yep.
We just touched on it a little bit, but what were surgeons doing? Was it really just pulling the skin tight, cutting extra skin away, and stitching it back on? And is there a place and time for that still today, or have we pretty much, as a plastic surgery industry, moved on from that?
Yeah, that's a great question. So yeah, that was historically the way the facelifts were being done because less was known about the anatomy. We truly thought that the skin was all that was sagging, and that's what you see on the outside, right? You see the gel and you say, hey, that must just be saggy skin that's creating that gel. Obviously, like everything in life, we've gained a deeper understanding of what really plays in to the aging process, which is why things have evolved and changed for the better. There is still a role for a skin-only facelift or neck lift, but it's going to be it's going to be more the exception than the rule.
Okay.
And what I mean by that is, let's say a patient has had a deep plane facelift, and they had a great deep plane facelift, a great deep plane neck lift, and then 3-4 years later, they do notice just a little bit of skin sagging, some lines in the skin, and they just want a little bit of a refresh look in a natural way. Sometimes it is appropriate to say, hey, if you want a relatively minimally invasive approach to achieve the goals you're looking for, then maybe we do just a little skin tightening because you trust that the structure that has been addressed previously is still holding up.
Got it. That makes sense. So let's move on to another type of facelift. It's the SMAS. And you mentioned that earlier, but what is that technique? And it was really popular. I think there are still many surgeons out there doing SMAS only facelifts and actually tout them as better still. But how is that different than the deep plane facelift?
Yeah, so this is where it gets very confusing. And I think sometimes even as surgeons, we kind of overlap these terms, SMAS and deep plane facelifts. The reality is that a deep plane facelift is a SMAS lift. It's just the way that we're approaching that SMAS. And it's the fact that we are doing more releasing of the SMAS. We're going farther medially. We're not raising as big of skin flaps as we used to raise. And so the SMAS technique, what that referred to is either with a SMAS plication, where a little bit of SMAS was just removed and then the surgeon would sew them up, or a little bit of SMAS release. That was kind of the next step in facelifts after the skin lift.
Okay.
From there, with increased understanding of anatomy and so-called ligaments, although they're not really ligaments in the face, and release these structures to get better mobilization of the SMAS, we then took the SMAS lifts and perfected it to now the deep plane lift. So that's one step farther on the spectrum.
So we've talked a lot about the deep plane facelift. Why don't all surgeons evolve? Why are some people still doing older techniques, and why haven't they really advanced with the new technology?
Yeah, it's a great question. So I think it goes back to specific training that surgeons get. And so again, not all surgeons are created equal. And so someone that touts himself as a facelift surgeon may just be dabbling in facelifts. So they may not have gotten the necessary training in order to safely do a deep plane facelift. That'd be number one. Older surgeons, maybe they just don't want to keep up with evolving trends and what's better for the patient, because they say, I've been doing this technique for 30, 40 years and it's worked in my hands. Well, it may have worked in 1985, but now we have something better. But I think they're a little bit scared or fearful to change the way that they're doing it. And then there's also the fear beyond that of just the important structures that are involved with the deep plane facelift. So when we're doing a deep plane facelift, we are carefully dissecting around very important structures, which is why if you don't have a very deep understanding of that anatomy, you don't have that training, you don't have that experience, it can be a very scary proposition for a surgeon. So lots of reasons why they wouldn't necessarily want to evolve or never really actually got that training to be the appropriate person off of that procedure.
That makes sense, which also brings us back to a previous segment we've had around choosing your plastic surgeon and making sure you do your due diligence, your education, and you find someone who truly specializes in these deep plane facelifts.
That's right, exactly.
Right, yeah. Okay, and then just thinking about the facelifts from the 80s, 90s, through the decades, how are they looking different today? Set the wind tunnel aside. That's a very specific look. But if you didn't have a wind tunnel look, say in the 80s or 90s, and there were a lot of beautiful facelifts back then, what did they look like then versus now? And are the facelifts of today lasting longer than the facelifts of the 80s and 90s?
Yeah. So great question. So I think that there were a lot of good facelifts being done in the 80s and the 90s, to be quite honest, right? And even though there was clearly the windswept look, there was clearly maybe less attention on the SMAS back then, there were surgeons that were doing versions of kind of deep plane facelifts, right?
Okay.
I would say that the biggest advancement, however, is treating some of the other structures, especially in the neck, that we didn't used to treat. So sculpting the deep fat underneath the platysma, sculpting some of the muscles beneath the platysma, like the digastric muscles, doing partial excisions or elevation and suspensions of submandibular glands or parotid glands to really bring out the definition at the jawline and mandibular angle. So I think now it's really more attention to detail and more attention to other structures. So it doesn't mean that in the 80s and 90s that there weren't good facelifts being done, but it wasn't as customized. So maybe only 25, 30% of the patients got a really good facelift because they didn't need all that other work done, right? Well, now what we're seeing is that facelifts are different, and we really need to customize. It's not a one-size-fits-all approach. The exact procedure that's going to be done needs to be tailored to that individual.
That makes sense. So how long could someone expect a facelift today to last if they're getting a facelift? Is it 10 years, 15 years, 20 years?
Yeah, and so this is, it's a great question, and I always like to give ranges because it's impossible to predict and say, hey, this is going to give you 7 years. In other words, when are you back in my office wanting another one, another facelift because you're back to where you are today? It's going to depend on age of the patient and severity of what they're coming in with. So if a patient's 42 years old and they notice just a little bit of laxity in their neck and their face, I realistically tell them that you may only get 5, 6, 7 years out of this procedure because you're not so bad to begin with, right? Versus my 70-year-old patients that come in, they've had no work done to their face or their neck, their skin and muscles hanging down almost to their collarbone, right? We've seen these people. And I tell them that realistically, you're never going to need another one of these, right? You'll never get anywhere close to the severity that you're coming in with today. So it definitely is going to depend on age of the patient. And then it's also, this is really important, it's going to depend on what happens after the facelift, which is outside of our control as surgeons. In other words, lifestyle, how clean are they living? How well do they eat? Are they protecting their skin from the sun?
Drinking a lot of water.
Drinking water, staying hydrated. Are they maintaining the results with CO2 laser? Are they volumizing with fat grafting and other ways of volumization to maintain those results? So a lot of other factors play into that range. But yeah, in general, we say for our average patient, 10 to 15 years, but there's a lot of, I'd say, variability within that.
Well, and we have a topic coming up in a future segment around the perimenopausal and menopausal facelift. And there is a big difference. If you have your facelift while you're perimenopausal, your estrogen levels are fluctuating. You still have some level of collagen and elastin in your skin. Really, when women come into those first few years of menopause, that's when they notice the most rapid changes in their face. And we won't go into huge details today, but I do think it's important to recognize that you might have a facelift at 46, 47 and have a wonderful result. But if you do it pre-menopausal and you then have a sudden sharp decline in estrogen and collagen, you might need a facelift in that 5 to 7 year range. However, if you are 50, 52, just, you've hit your menopause years and you pull it up, you're going to have a more drastic result, but it may last longer because your body is finished going through that change of life. Yeah.
And I would even extrapolate that a little bit more to even our male population.
Sure.
Right.
Yeah.
So testosterone levels, muscle mass. So, obviously we're doing more facelifts, just globally more facelifts in women, but the trend is more men are having these procedures, and so it really affects both males as well as females, and you're absolutely right. You hit the nail on the head.
So future of facelifts, we've come a long way. What do you think the next evolution is? You've talked a lot about focusing on structure and personalized medicine for facelifts. What else is there?
Yeah, so we're already sort of seeing that in that with facelifts, again, we are customizing the approach to that individual patient, right? So no two facelifts are created equal. We're going to do them a little bit differently from one patient to the next. So we're already kind of seeing that right now. That's number one. Number two, the rise of fat grafting with facelifts has just been a game changer. And so I always tell my patients that I'm doing probably 20 to 30 times the number of fat grafting cases, with or without facelifts than I was a decade ago. And that's just because the technique has gotten better. The predictability of survival rates with the fat grafting has gotten better. We've just with technology improved that process. So we're seeing that right now. But I think that the next thing is going to be implementation of more technology into facelifts. And what I mean by that is that in general, we're still kind of using the same tools that we've always used. What has evolved the most is technique, right? We've talked about the skin lift, the SMAS lift, the deep plane lift, the customization. But what we haven't talked about is all of the other possible technologies that could play into things. Robotics, AI, pre-surgical planning, or maybe even more importantly, post-surgical scanning to see where maybe we could have done that procedure slightly better. They got a really good result. Did they get a home run result? And if they didn't, why? So are we doing things like MRI scans to see which structures have failed in that procedure? That would make us better as surgeons. So I think that eventually we're going to be using more of that technology to help us get even better than where we're at right now.
Well, I'm looking forward to walking into the future with you with facelifts and beyond. And thanks for joining us today.
And if you like what you heard today, please be sure to like the video and subscribe to our channel.